Hi, I am Taylor Buchanan, and the area of biofeedback that I chose to do was heart rate variability and depression. So, first, just a little bit of background on depression. Depression is a serious mental health disorder that must be treated, and if one thinks they might be suffering from depression, it is in their best interest to speak to a professional, regardless of the stigma behind depression. So in 2016 alone, specifically in the US, depression affected about 16.2 million people. Um, but the thing is, only half of these people sought treatment for depression. So here's a couple quotes that I found of people suffering from depression and like how they how it felt to them, how they put depression into words. Just a couple that stood out were, it's like you're drowning, but everyone else around you is breathing. Um, when you're depressed, you don't control your thoughts control you. And depression is like feeling like you've lost something, but having no clue when or where you last had it. And then one day you realize what you lost was yourself. Um, so just those just kind of stood out to me as like, wow. And it's important to note that like what one may feel when they're depressed, another may feel different. So, heart rate variability is an area of biofeedback. What is biofeedback? It is a way of monitoring bodily functions by training the brain to voluntarily control these functions. Um, there's other areas of biofeedback that include neurofeedback, sweat gland feedback, temperature biofeedback, respiratory biofeedback. But heart rate variability is the area that I chose. So, with heart rate variability, it uses sensors placed on the finger, earlobe, chest, or wrists, even. And it measures the time interval between each heartbeat. So, how does it work? This variation is controlled by the autonomic nervous system. When the brain processes information, it goes directly through the hypothalamus, through the autonomic nervous system, and then signals the rest of the body to react. So, by checking heart rate variability, it is a good way to tell if there's an imbalance in any of these systems. The standard for analyzing heart rate variability is usually done by an electrocardiogram, but on a much simpler level, it can be done just by using simple heart rate monitors. So, heart rate variability and depression. Heart rate variability treatment for major depression is an alternative way to reduce depressive symptoms with not as many negative side effects as normal antidepressants have. So basically, research shows that those suffering from depression may experience an increased heart rate, decreased vagal tone, sleep disturbances, sympathetic arousals, those kinds of things. Um, and according to Maria Karavitis from the University of Medicine and Dentistry in New Jersey, heart rate variability biofeedback produces a significant increase in the change in heart rate in the for each millimeter. Each millimeter change in blood pressure, also known as the baroflex gain, um, improved homeostatic control over blood pressure, and an increase in nerve activity. So the process through anatomical projections from the baroreceptors to the hypothalamus and the limbic system and increase parasympathetic activity would be expected to increase the modulation of emotionally and autonomically mediated reflexes throughout the body, which then should result in like depression symptoms being reduced. So just a quote from Beavers, 2010. I have that source in my works cited. But this quote, heart rate variability is thought to be a physiological index of emotion regulation capacity because many of the brain structures involved in emotion regulation are also involved in the regulation of the autonomic nervous system. So I thought that just kind of like put heart rate variability and depression into kind of better words. So there was a study that I looked at for heart rate variability and depression. So there were 67 females. They were all undergraduate students from introductory classes at a large university. They were all around the age of 18. And the majority of the females in the study reported low symptoms of depression. I thought it was a little odd and kind of a limitation that a lot of the studies I looked at only had women as their participants, but the reason that these studies use all women is because it is just proven that women are twice as likely to report experiencing depressive episodes. But in this study with the 67 females, they used a self-report questionnaire, and it assessed a bunch of different things, like the presence of any depression, the severity of what they were feeling, whether it was cognitive, motivational, those kinds of things. So the heart rate variability portion of the study was an extremely important indicator that heart rate variability is a good way to measure someone's vulnerability of developing depression. And they found that depressive symptoms were inversely correlated with skin conductance. So this study just kind of helped these females see how vulnerable they were in getting and developing depression. So just a little bit more research that I found interesting. So researchers at Washington State University School of Medicine found that depression interferes with the heart's ability to slow down and speed up in responding to stressful situations. And measuring heart rate variability may be a good tool to look at like lifestyle changes, and it is possibly a good motivator for changing unhealthy behaviors in just the way that it measures. So a lot of the articles that I looked at really like expanded my knowledge on both heart rate variability, depression, and biofeedback in general, because this is like an area that I had never really looked at before. So like other than what we learned in class and my research, I had never really known anything about biofeedback. And I found it super interesting that like some areas of biofeedback are like on much simpler levels, like a Fitbit or scales, like thermometers. It doesn't have to be this like crazy equipment that you have to go to a lab to use. Biofeedback is, in a bunch of different places. So it would be interesting to research how other areas of biofeedback, like neurofeedback, would in depression, because a lot of the studies I looked at proved that heart rate variability is a good treatment, but it's an even better at looking at someone's susceptibility and vulnerability in developing depression. I also thought it would, many of the studies I looked at were conducted on women, and I would like to see more studies conducted on men and how depression and heart rate variability, how men would be, just because none of the studies I found had any men in them. So I thought it would be good to see how heart rate variability would affect men with depression. So thank you.